Chlamydia is a common sexually transmitted disease caused by a bacteria called Chlamydia trachomatis. It mostly occurs in young people, especially in young women. However, it can also occur in men and in all age groups. Chlamydia is sometimes called a silent infection because majority of the people who have chlamydia, regardless of their gender, does not notice any symptoms. People who do notice symptoms often don't recognize the signs that they have chlamydia until a few weeks after they have been infected. In fact, according to the article that I have read, about 90% of women and 70% of men with STIs have no symptoms. Since chlamydia cases are often asymptomatic, it's easy to spread chlamydia to someone else without realizing it. Chlamydia infections are treatable and curable, but if left untreated, it can spread to other parts of your body and can lead to a more serious and long-term health problem. So it is important to receive treatment as soon as possible. To know more about chlamydia, our next discussion is about its causes, which will be discussed by Mr. Brian Sereno.
What causes chlamydia? Chlamydia infections spread through sexual contact when vaginal fluid or semen containing the bacteria that causes chlamydia travels from one person to another. Sexual contact includes all kinds of sex, including sex that doesn't involve penetration or ejaculation. There are lots of ways that the fluid from one person's genitals can transmit the bacteria that causes chlamydia. First is the intercourse. Bacteria pass from one person's penis to their partner's vagina or vice versa. Second, anal sex. Bacteria passes from one person's penis to their partner's anus or vice versa. Third, oral sex. Bacteria passes from one person's mouth to their partner's penis, vagina or anus or vice versa. Fourth, sex involving toys. Bacteria pass from a toy with the bacteria to a person's mouth, penis, vagina or anus. The last one, manual stimulation of the genitals or anus. Less commonly infected vaginal fluid or semen can come in contact with a person's eye, causing an infection called conjunctivitis. For example, this can happen if you touch the genitals of an infected person and then rub your eyes without washing your hands first.
Chlamydia trachomatis can be associated with: first, the pelvic inflammatory disease or PID. PID is an infection of uterus and fallopian tube that causes pelvic pain and fever. Severe infections may require hospitalizations for intravenous antibiotics. PID can damage the fallopian tube, ovaries, and uterus, including the cervix. Second is infection near the testicles. Chlamydian infections can inflame the cloaca tube located beside each testicle. The infections can result in fever, scrotal pain, and swelling. The next is infections in newborns. The chlamydian infections can pass from the vaginal canal to your child during the delivery, causing the pneumonia or a serious eye infection. Ectopic pregnancy. This occurs when a fertilizer egg implant that grows outside of the uterus, usually in a fallopian tube. The pregnancy needs to be removed to prevent life-threatening complications such as a bruised tube. Infertility can cause screening and obstructions in the fallopian tube, which may make women infertile. Reactive arthritis, also known as arthritis syndrome. This condition typically affects the joints, eye, and the urethra, the tube that carries urine from your bladder to the outside of your body.
And now, we will discuss about the treatment for chlamydia. So some sexually transmitted bacterial infections are starting to become resistant to antibiotics, and this makes them hard to treat. But the good thing is, chlamydia can be cleared up with antibiotics in about a week or 2. But you should also bear in mind that you should not stop taking your medication just because your symptoms improve if there is any. You should ask your provider about what follow-up is needed to be sure that your infection is gone after you finish taking your medicine. So there are 2 most common antibiotics that are used to treat chlamydia infections, and these are azithromycin and doxycycline. So azithromycin is usually taken as a single dose, whereas the doxycycline is usually taken for 7 days. Make sure you only take antibiotics prescribed by your provider and take all your medications until the infection is gone. So there are also things that you should do as part of your treatment. First, you have to abstain from sex until your infection has cleared up. So starting the treatment doesn't mean that you're in the clear. You have to take all your medications as your provider directs and avoid all sexual contact in the meantime to prevent the spread of infection. Next is to contact all sexual partners. So you have to tell any sexual partners from the last 3 months that you're infected so that they can get tested too even if they had no symptoms. The last one is to get tested for other STIs. So you already have a knowledge that there are many other STIs aside from chlamydia. And it is also common for a person to have multiple STIs. So it is important to get tested and receive treatment that's tailored to each infection. Moreover, antibiotics can get rid of your infection, but it can't reverse any harm that the bacteria may have caused to your body before the treatment. This is why it is so important to get screened regularly, not only for chlamydia but also for other STIs as well. You have to see your provider or doctor at the first sign of symptoms and get treatment immediately if you're infected to avoid any more serious problems.
Preventions. The surest way to prevent chlamydia infections is to abstain from sexual activities. Use condoms. Use a male latex condom or a female polyurethane condom during each sexual contact. Limit your number of sex partners. Having a multiple sex partners puts you at a high risk of contracting chlamydia and other sexually transmitted infection. Avoiding douching. If you're a person with a vagina, don't douche. Douching can increase your risk because it reduces a number of good bacteria in the vagina. And the last is always cover sex toys with a new condom and wash them after use to reduce your risk of getting chlamydia.
So that would be all, and I hope you learned something.